I'm Kiera Morgan. Thanks for joining me on this episode of Coffee with Kiera, sponsored by the Human Being in Newport and Lincoln City. And I am thrilled to be here at the Phoenix Wellness Center. And I'm talking with folks that run the center, and we're going to find out a little bit more about the great work that they do. Can you please introduce yourselves and tell us a little bit about what you do?
Hi, my name is Danielle Payne, and I am the one of the owners here, and I'm also the program administrator. And I also have a credentialing for counseling, so I'm a CADC1, and I am a CRM2, which is a Certified Recovery Mentor. And so I do direct services, but I mostly do a lot of more of the admin.
And tell us a little bit about you.
I get to do the fun stuff. I'm Nicole Rariden. I'm a peer support specialist, so I get to do a lot of outreach, crisis calls, people that just come into the office and wants to seek services, people that are referred to us by all different outside agencies. I just get to meet people where they're at and help them figure out what path they want to start taking some changes in their life.
Wonderful. Tell us a little bit about what you do here at Phoenix Wellness Center.
So here at Phoenix Wellness Center, we offer intensive outpatient services. So this is for people that are suffering with substance use disorders. So, and that is all ages from, we have teenagers here all the way up through, adult ages. So we really have a large spectrum of age, that we work with. And we offer also Dewey services. So if somebody gets like a Dewey in Lincoln County, we offer the rehabilitation program for that, and it's typically about 90 days. And then also we do serve teenagers, in school if they get in trouble during school or MIT, things like that. We also can help them with, getting through that. That's required.
So you work with folks who have substance and alcohol issues?
So substance use disorder, it would be across the board. So it would be alcohol use disorder or anything, there's methamphetamines and opioid use disorder. There's just across the board, there's so many different disorders. And we do believe here at Phoenix that it could be a progressive medical disease. So we do treat it as such.
And what got you to start this kind of program?
Okay, so how we started is the story is kind of long, but I'll try to make it short. Well, let's see. It goes back probably about 13 years ago when our clinical director, W.I. Payne, he had gotten to the field and he had been working for the Floods tribe there. And then shortly after that is when Wiley Stokes started, which is one of the other owners and our outreach director. He started working for the tribe as well. And they had been working in this field for a while. And then Ashley Ramirez, which is one of the other owners, who's the clinical supervisor here, she came along, I think about 5 years ago. And then I started shortly after that, and we all worked for the Floods tribe in the behavioral health department. And we made a lot of connections here in Lincoln County. We actually made a lot of good relationships with the drug and hope court team that works here at the courthouse, and DHS and several other providers in the county. And when we had started working within this county, we kind of noticed that there was the need for more care. We noticed that there was a lot of people that were on waiting lists during that time. And for us, we understand the magnitude of the people getting help and how sometimes it's there's just really a limited amount of time to be able to get them the help that they need. And we noticed that there was a lack in resources here in the county. So we had started looking at what it would take for us to get our own business going. And so we had started looking into that, and things just seemed to fall together. And that was in the beginning of 2020. So this is before COVID and that hit. Well, we had got everything together, and we found a space here for lease in Newport, and it was pretty affordable at the time, and so we started working on getting everything together, and announced, that we were going to be providing services here in Lincoln County, and it really has been an amazing ride. This whole thing, everything seemed to just fall in line, and even that being said, we started right at the beginning of COVID. So I'm talking about we were just rolling with the punches. So we started and then we got hit with that, but we just thought, okay, well, we don't have an option of letting this fail. We have too much writing on it, and we feel like we have like a calling to do it. So we kind of just did what we could to do telehealth services, and we all had masks here. We're spraying everything. We're trying to keep everybody from being sick. We're doing a lot of online groups and online appointments and anything that we could do to keep people being interested in their own recovery. So that's what we were doing during that time. And, any connection at that time, I felt like it was helpful. And because there's people that are suffering, the people that were, stuck at home and they were relapsing, and there was a lot of we were just seeing so many different stories coming in during that time of people just being, just suffering and then being isolated in their own, just by themselves. So we just kind of rolled with the punches, and this slowly but surely, we have been able to kind of get back. We still do keep a lot of the online stuff and a lot of the telehealth services, because I think even the state of Oregon saw that there was a benefit to that. So if there's anything that came out of that, it was the fact that we do continue this work, and we try to break down barriers to people getting help, and that is one of them, the online or the groups and the telehealth appointments. So.
And Nicole, tell us a little bit about what you do and how you help folks.
So I'm a peer mentor, which is I kind of just do outreach. I meet people exactly where they're at. For example, somebody might call here and they need help trying to figure out how to get sober. They're stuck in their addiction, not sure what to do next. I know for myself, that's where my life was at, and having somebody to call to be able to say, I can come to you right now. So this job literally allows me to do that. I leave work, I go straight to their house, to the hospital, to the sidewalk, to their tent, wherever they're at. I'll meet them right where they're at and talk to them about what kind of services Phoenix offers. I can get them into detox right away. We can start getting paperwork done and call detox and get an assessment done. And we provide transportation as well, which is amazing, because not only can I meet them where they're at, but I can get them to where they need to go immediately. So I do that on a daily basis. I go to the jail a lot and speak with people that have been incarcerated for using or maybe not using. Maybe they haven't been arrested for using, but they have a past of addiction and they want help. Like Danielle said, we work a lot with a lot of people in the community, so we get a lot of referrals from outside agencies, and those referrals come in the door through text, through a phone call, through telehealth, through email, through our Facebook page, all over across the board. So it's pretty cool to be able to hang up the phone and say, I'll be right there, and just sit in their living room with them and talk about how I can help them get to where I'm at today in my life. It's a pretty big gift to be able to give life back.
So do you guys also work with other agencies in town?
Yeah, we have several relationships with a lot of the agencies. I think one thing that we always talk about is how important it is for us to have relationships with other providers in this community. So we do work a lot with several agencies that are here. And we do that because we understand that this work isn't just for one agency or one person. Like, this is going to take a lot of people to come together to, be able to help as many people as we can.
And you work very closely with the tribe as well. Can
Yeah.
you tell us about that?
Yeah, we work with the tribe. We do a lot of events with the tribe. We just had Jen Metcalf, which is the care program, and she came and did that trauma-informed training with our staff. And that's just an ongoing relationship that we have, and we'll continue to do things together to try to get in. And yeah, it just opened up that they're going to be seeing the community members at their MAT program in the Let's clinic. So that will be great for our community as well, because the more resources that we have for our community, the better.
Absolutely. Are you guys noticing an uptick? We keep hearing about, you know, fentanyl and all these, heroin and things like that. Are you seeing an uptick in drug use in Lincoln County?
I would say for sure. I think kind of what I see more of, just even in the less than a year that I've worked at Phoenix, is the amount of drug use is different. The type of drug use is different. I think fentanyl definitely is affecting people in their addiction in a different way. They need a lot more mental health help, a lot of other resources other than just addiction help. So it's definitely amazing that we can meet them where they're at in a situation like that, because I know myself as a recovering addict, it was important that somebody met me where I was at my broken point, because it's a really small window. Like Danielle said, it's a window that you have to immediately get into. And if you miss that window, they're probably going to go back out. And with the use of fentanyl, there's a good chance they're going to overdose. So it's super scary in our community. And I feel like it's definitely not going to get less. I feel like it's going to get worse.
I definitely think, especially the last 3 years, going with COVID, like we've done a lot of screenings on people that have come in, and I definitely do want to talk about what Nicole said about it changing. The use is changing because fentanyl is being pushed into the streets at such an alarming rate, and it's so cheap, and it's being put in everything. So now we have to look out for our kids that are, they don't really understand what they're getting into. We have to look out for people that maybe think they're just doing meth, but they're not knowing that this is laced with fentanyl, and so we're really just seeing a lot of that happening. And so it is changing, and it is pretty scary out there right now. We just try to give as much information and education about it as we can, and really just try to do what we can with it. It's such a scary thing out there right now.
What about youth? Are you seeing things going up as far as use with youth as well?
I think the thing about the youth that is scary is the vaping situation, and we do see a lot of screenings right now for kids that are vaping, and that could be using marijuana or the nicotine pods, and we are seeing a huge increase in that being used in the schools even, and also there has been some, I don't have the numbers right now, but I know there is a lot of fentanyl. There's more cases of like overdoses happening within teenagers within Lincoln County during this time. So it is pretty concerning. I think that we try to do what we can to, like I said, just get the education out there. We do have a Narcan event coming up November 16th at 11 a.m. here at Phoenix Wellness Center, and that will just give information. If you want to talk about that.
Yeah, so our Narcan event on the 16th, it'll be very similar to the ones we've had before. It's basically just an overall of what naloxone and Narcan is, what it consists of. It is an opioid blocker, so if somebody overdoses on fentanyl or on an opioid and you hit them with Narcan, it'll reverse the effects of that in changing or saving their life. So I think it's important to educate our community, as many people as we can. Even if one person only shows up to our event, I'll keep doing them, because it's that one person that's going to reach the next 5 people. So our event will be November 16th at 11 here at Phoenix, and we'll be giving away Narcan as well to anybody that attends. And with that being said, if there's anybody in the community that would like me to come and speak to their family or speak to any type of event or gathering about Narcan and what it's about and how to use it and what the effects are of it, I would greatly be happy to do that.
All right. Ladies, is there anything else that you? Oh, real quick. um, do you have any use for volunteers?
Um, we because we're so strictly regulated by HIPAA, we have to be very careful about our volunteer situation. We just really value like confidentiality here, so that is something that we haven't really got into at this point. But we could kind of maybe like brainstorm different ways that it could be done. I guess maybe for like events and things like that. So that's something we can think about.
All right. Is there anything else that you'd like to add?
I just want to say that Phoenix Wellness Center is open to the public, so anybody that is suffering with substance use disorders, anybody that even has questions about it, if anybody, family or friends are struggling, just reach out. Like, there's no stupid questions at all. Like, even if it's just, a simple, like, hey, I just wanted to know about this or that, or, somebody, maybe their friend is suffering and they just wanted to ask some questions. Like, we're totally open and we're honest, and there's a lot of people here that are in recovery and understand how hard it is to even walk through the door. So just know that it's open. We're welcoming. We try to be as we try to break down as many barriers and you can go on our website to find more information. And we'll talk a lot about our story on there. And uh,
What about support groups? Do you do like Al-Anon, AA meetings, things like that?
we do. There is outside meetings. We don't have any in-house Al-Anon or AA meetings, but we definitely have resources for those available. Because of COVID, some of that stuff was shut down, but it's just recently opened back up again. So we'll be having more information, and we can list that on our website as well.
All right. Thank you, ladies, so much for providing such important information, and thank you for what you do in our community to help those in need. It is deeply, deeply appreciated. Is there any way that you need any kind of support from the public or anything you want where people can go to get more information? You mentioned a website.
Yeah.
We have a Facebook page too. I know that's easy for people.
Yeah, and our website is Phoenix www.phoenixwellnesscenter.org, and then our Facebook is Phoenix Wellness Center. We're pretty active on there, so you'll see a lot of information coming through. You'll see information about our employees and kind of things that are coming up. We keep it pretty up to date with that. So
Awesome. Well, thank you so much for joining me on this episode of Coffee with Kiera. Again, sponsored by The Human Being in Newport at 6th Street and Highway 101, and in Lincoln City at the north end of the highway, and is on the west side next to TLC Credit Union. Thanks for joining me for Oregon Coast Breaking News. I'm Kiera Morgan.
thank you.